a related genetics question, but one that, Bob, you might want to be you may be able to answer, or you can call for a lifeline from the audience if you want, is to explain to the audience why, if the genes that Judy studies only account for 5 to 10% of cancer, we still describe cancer as a genetic disease. What do we really mean when we say that?
I'm glad you asked that question too.
I'm here to please.
So when we use the word genetic, we're really talking about two different things. When most people hear the word genetic, they think these are genes that they inherit in damaged form from their parents. And that's certainly one kind of genetic disease. The majority of cancers, however, arise in cells and tissues in which perfectly good genes were inherited, and those genes become damaged in those tissues during a patient's lifetime. And we have different words for this. We call germline mutations, what you inherit from your parents, and somatic mutations, what are damaged in your tissues during your lifetime, genes that were inherited in pristine form from your parents. Now, the question is, if only 5% of breast cancer can be, of familial breast cancer can be associated with BRCA1, does that mean that only 5% of breast cancer derives from genes that women inherit in some damaged or suboptimal form from their parents? Is that the conclusion? And the answer to that is decidedly no. There are lots of other genes that we inherit that are subtly altered from our parents that affect and increase or decrease the risk of breast cancer. And the most dramatic way of demonstrating that is to look at a group of women who have sporadic breast cancer. Sporadic means occurring randomly rather than any kind of familial pattern. And if you look at their sisters and their brothers and their parents, and you look at the normal cells in their sisters and their brothers and their parents, you find as many as half of those individuals have compromised DNA repair activity in their cells, even though those people, the sisters and the brothers and the parents, never came down with breast cancer. What I just told you means that in those families, even though we haven't identified the gene, we have no idea what the genes are, there is a subtle inherited tendency, a proclivity to develop breast cancer. And it could be that the majority of women who develop breast cancer and who don't have BRCA1 or BRCA2 damaged genes, the majority of those women inherited subtle forms of various breast cancer predisposing genes from their parents whose identity remains elusive for now and may for a while to come.